Welcome. Thank you for joining us. I'll go ahead and get things started. I think we'll be joined by a few more people as the afternoon wears on. Thank you so much for coming out today. My name is Laura Heisler, and I am Director of Programming for the Wisconsin Alumni Research Foundation, otherwise known as WRF. And it is my pleasure to introduce this afternoon's program and to offer a bit of background on the Gilson series as we do at all of these events. The Gilson series was launched almost a decade ago in 2004 with a generous gift from the late Dr. Warren Gilson. Dr. Gilson was a UW Medical School graduate, a faculty member, and a prolific inventor of medical electronics and instruments, as you'll hear much more about as we go through the program. He was also an entrepreneur and founder of Gilson, Inc., a leading manufacturer of analytical instruments headquartered just down the road in Middleton. In 2002, Dr. Gilson left WRF a significant gift to promote the exchange of ideas between the university and Wisconsin businesses. He often recollected that as a med student, he valued the informal conversations he had with colleagues in the cafeteria of the university's hospital and wanted to ask us to try and recreate something like that environment. And we have tried to do that here in the town center at the Wisconsin Institute for Discovery, which we think is a perfect venue to continue this conversation. And it's in the spirit of creating connections and dialogue among UW faculty, staff, students, business leaders, and community members that we host these sessions to encourage entrepreneurship, innovation, and interdisciplinary collaborations. At these events, we're often joined by members of the Gilson family and employees of Gilson, Inc., and I'm delighted today that we are joined by several members of the company and members of the family, including Bob Gilson, Molly Gilson, and Dan Gilson, as well as Gilson CEO Attica El Sayed. Thank you so much for joining us, all members of Gilson Incorporated. We're delighted to have you here today. One of the highlights of our Gilson events is that we leave time for discussion and follow the formal part of the presentation with informal networking over great food and drink, and today is no exception. And so after today's program, I would like to invite you to linger in the atrium just behind me over here. Actually, the door will magically open when it's time to attend the reception. If you've been to other Gilson events before, the location is a bit different. We have some other activities going on in the South Atrium, so we'll convene in the North Atrium. Now, today's program is a rare treat and opportunity in what is actually the year of innovation on the UW campus to hear a one-of-a-kind story about a Wisconsin-born innovation that transformed several fields of research worldwide and continues to do so to this day. To get things started, I'm going to be turning things over to Bob Gilson in just a moment, and he in turn will invite our other two speakers. I'll start, however, by providing some biographical information about all of these presenters and start with Bob Gilson. Dr. Gilson is the president and owner of Gilson Incorporated. He holds a bachelor's degree in chemistry as well as a medical degree from UW-Madison and has been granted numerous patents in the fields of manual liquid handling, automated liquid handling, and sailing. In addition to his role at Gilson, Bob Gilson has an ownership interest and is actively involved in two other Wisconsin-based companies, Electronic Theater Controls, also in Middleton, and Latitude Incorporated. Following Dr. Gilson, we'll be privileged to hear today from Dr. Eric Marteau-Dautry. Dr. Marteau-Dautry is an alumnus of UW-Madison, a prolific inventor himself, and a remarkable humanitarian. A native of France, he co-founded Gilson France and served as its acting president from 1972 to 1999. He holds a bachelor's degree in mechanical engineering from UW-Madison and an MBA from the École Centrale des Arts et Manufactures in Paris. He also worked alongside Dr. Warren Gilson, to improve the design of the first adjustable micropipette known as Pipetman, and is an inventor on numerous U.S. patents related to liquid handling. He led the commercialization efforts for Gilson around the world, including the formation of Gilson offices in England, Germany, and Italy. Before that, he served in the French Army from 1959 to 1962 in the North African desert. When he left Gilson in 1999, he and his wife helped form a charitable organization called Pour un sourire d'enfant, which translates into For a Child's Smile, as a nonprofit in France aimed at saving and educating abandoned children in Phnom Penh, Cambodia. Today, this organization takes care of more than 6,000 children every day and received the Human Rights Prize from the French Republic in the year 2000. Our final speaker tonight is Kevin Barrett, who is the Senior Vice President of Strategic Business Development for Gilson. Mr. Barrett holds a bachelor's degree in biology from the University of Salford in the UK, and he joined Anachem UK as a Gilson subsidiary right out of school, and to this date has 33 years of experience working with researchers in drug discovery and healthcare. While at Anachem, he progressed through several management roles to the position of associate director, and in 2003 joined Innovadyne, a California startup developing nanoliter non-contact liquid handling technologies, and became their president and co-owner until it was acquired in 2008. Post-acquisition, he was a business development director for IDEX Health and Science until returning to Gilson in 2010. So as you can see, we are joined by an illustrious roster of speakers today, and I will invite Dr. Bob Gilson to come up and get things started. Thanks so much.
Well, thank you for all coming this afternoon. It's a sunny afternoon. I'm sure you all wanted to be outside, not in here. Our family founded the Gilson Lecture Series because we really believe that the way things get done and progress is made is by interested people talking with other interested people and cross-fertilizing their ideas from physics to chemistry to medicine, and you never know what will come of it. There is a belief that people can be entrepreneurs, and I want to be an entrepreneur, and I have an idea. But the idea has to be to do something with someone. And the collaborations that you have are what make the big difference. The people you choose to be around make much more difference than if you have an angel fund or a venture capital fund or someone who's willing to give you money. If you don't have an idea and are not dedicated to that idea, it isn't really going to matter. Most of the people that I've met in all of the companies that I'm involved with, including Gilson and Eric, all were involved in hoofers. They were all sailors at hoofers. And so it had nothing to do with any plan to do anything. Hey, these are neat people. I'll go and hang out with them. And one of the things that came out of this was the Pipetman, and Eric will tell you how that progressed. One of the things I've been charged with is, I'm assuming that most of you know what a pipetter is, and so but there may be some who don't. Basically, it's just a device. You can push a button, suck up liquid, dispense the liquid, and the key thing which my father did was make a way that you could do it in an adjustable, continuously adjustable manner so that you could have any volume that you wanted. You weren't restricted to 10 microliters, 15 microliters. If you wanted 12.6, you could do 12.6. The other things that are in innovation is that formality is not that useful. One of the things that my father taught me was most of the best ideas, he said, took place when he was in the shower. And then we would go out and take brown wrapping paper and sketch the ideas on brown wrapping paper. Brown wrapping paper was ideal because you could throw your idea away. You weren't even wasting good white paper. So you just tear it off, do it again. And then when you had an idea on the brown paper that seemed like it was a good one, then you moved up to the harder materials like cardboard and plywood and made a rough prototype that way. So you could always change things. Things were not set and fixed very early in the process. And we're happy to have Eric back. It's been a long while. He had a lot of happy memories coming back and seeing where he had worked all these years. And I think it's a real pleasure to be able to introduce him and to have him take over the program from now on. And to you.
Hello, good afternoon. It is good to be back in Madison. It feels like returning home. 50-some years after spending 4 years in the College of Engineering at the University of Wisconsin-Madison, from which I graduated in 1959. I'm very proud and I feel privileged to present to you the achievements of Dr. Warren Gilson and our long-lasting collaboration. The Worf Gilson series has been initiated and supported by Dr. Warren Gilson for nurturing the exchange of ideas between the university and small businesses and promoting entrepreneurialism in Wisconsin. Dr. Gilson's personal achievements, his many varied interests, his undertakings, his successes have been and remain good examples of what collaboration between a university and small businesses can do. His open mind and forward-looking vision further extended into a close, trusted, and long-lasting collaboration with a former foreign student, me. Warren Gilson was born in Wisconsin. He attended medical school and became a professor of experimental physiology at the University of Wisconsin-Madison School of Medicine. In the mid-40s, in a small workshop in Madison, he designed and built physiological recorders that were widely used by students. At the same time, he collaborated with colleagues in the Institute of Biochemistry, solving with simple and robust solutions such difficult problems as, for example, the study of the metabolism of mitochondria. It is at this time that he collaborated with Dr. Henry Lardy to design and manufacture the Lardy-Warburg instrument, the Lardy-Warburg respirometer to measure oxygen uptake in microorganisms. With Dr. Stephen Kuby, he designed the Gilson oxygraph, which features an original vibrating oxygen electrode. He developed further high-voltage electrophoretors to isolate amino acids, as well as fraction collectors and UV detectors for liquid chromatography. Dr. Gilson collaborated with university bioscientists who had needs for which he was eager to find original and innovative solutions that he could manufacture in his small workshop. In 1955, I took the opportunity of a special US government program which sought to encourage foreign students to come and study in the US. And I came to study engineering and business at the University of Wisconsin-Madison while working to support myself at the Gilson Company, a large machine tool company located on East Washington Avenue in Madison. I was a student during the day, worked at Gilson in the night shift, and sailed at the Hoofers on Lake Mendota in my spare time. Dr. Gilson often had his lunch at the old French house on University Avenue near the College of Engineering, where he liked to practice his French. He also came to the Hoofers to relax. We often intersected in both places. He was interested in my program. I was interested in small businesses and entrepreneurs who created new things, who innovated, who developed new concepts. We had much to talk about. 1957 was the year of the Treaty of Rome that settled the basis for the EEC, the European Economic Community. For the young foreign student I was, the rapid development of Europe was a real and exciting prospect. On a Sunday afternoon at the Hoofers, I was trying to sell Warren on the opportunity to do something in Europe. He looked at me with half-closed eyes, took a big puff on his cigar, and said, under one condition. What is it? I said. You take care of it. We shook hands. This agreement lasted over 40 years. It was, as far as the two were concerned, a partnership for better or for worse. The worst never happened. This long-lasting association took its roots on mutual trust. In the same period, with the increasing demand for the instruments he was making, Gilson moved his operation to a new plant that he located in Middleton. Together, we discussed the opportunity of starting a plant in France to manufacture and sell his instruments in Europe. We started Gilson France in a small building we were renting out in a Paris suburb in 1962. We were a small startup, not much different from the ones you hear about that started out in someone's garage in the Silicon Valley. Gilson kept working on new concepts. It was then that he designed his most significant and original instrument, the Gilson respirometer, which gave the possibility, with an original digital counter, to measure and read directly in microliters the oxygen consumption in microorganisms. This direct reading in microliters eliminated complex calculations. A few years later, in the late 60s, while attending the conference of the yearly FACEB meeting, FACEB stands for Federation of American Societies for Experimental Biology, it became obvious to us that the digital counter could be used for other applications, and we decided to look for ways to adapt it. Very soon, Warren Gilson had a new idea. In the spring of 1972, I found on Dr. Gilson's desk an early prototype that he had made in just over a weekend around the digital counter. It looked like an adjustable micropipette. He had it tested in his lab and at the university hospital, but no one had shown any interest, since only fixed volume pipettes and glass pipettes were used at the time. It sat there unused. I marveled at the sight of this prototype. This new and original concept, I thought, could greatly simplify manual liquid sample preparations. With more tests, this concept could offer the possibility to extract and transfer any amount of liquid samples from one test tube to another with accuracy. I took the prototype back to France, redesigned it so that it could be manufactured on a larger scale and used as a convenient handheld micropipette. The success was immediate, but we also received complaints. The pipette was not precise enough. It had a 2 or 3% error margin. We therefore developed a new method for gravimetric calibration using a mechanical microscale and water. The assembly floor had to be transformed and moved into an air-conditioned, constant temperature room equipped with several microscales. Every technician working on a scale had to follow the calibration procedure he or she was given. Quality assurance standards did not exist at that time in our industry. We named the Gilson pipette Pipetman. A woman technician sent us a complaint saying, "Why do you call this pipette Pipetman when we all know that it's the women doing the work? Why don't you call it Pipette Woman?" But as it happens, Pipetman stands for Pipette Manuelle, which in French means manual pipette. Being designed around the original digital counter, the model was not very ergonomic in the beginning. With Robert Gilson, the son of Warren, we sculpted in a block of plastic what was to become the final model. We had it tried and handled by many people in the shop, people with hands of different size and shape. We identified Madame Petitmain, Warren Gilson called her that way, Madame Petitmain, a female employee with particularly small and delicate hands, and we asked her to try it. We completed the design and added a handy tip ejector. This new model, white and blue, was introduced in 1974. My wife even contributed and designed the convenient carousel Pipetman stand. The Gilson Pipetman was the first digital adjustable micropipette with a tip ejector that was accurate and precise throughout its range. It replaced conventional glass pipettes that were neither accurate nor precise. In this way, it brought about a revolution in bioscience labs, greatly simplifying the work of scientists and technicians. The Gilson Pipetman was the right product at the right time, at the right price. Once, while I was visiting a lab in San Francisco to present the prototype of another instrument, I introduced myself as coming from Gilson Company. The technician who greeted me said, "Gilson, Pipetman?" He literally kneeled in front of me saying, "Thank you, thank you. You saved our life. You made our life so much simpler." That's how successful the Pipetman was and still is. With the success of the Pipetman, Gilson was becoming a recognized player in the scientific instrument industry. I was asked by the European Bureau of Standards, located in Frankfurt, Germany, to participate in its work to define ways to guarantee precision and accuracy for adjustable mechanical micropipettes in replacement of glass pipettes. The orders kept coming at a rapidly increasing rate. We had difficulty to meet demand. When previously Gilson was manufacturing instruments in batches of 20 or 50 units, we started to manufacture pipettes by tens of thousands and deliver pipette tips by hundreds of millions. The company had to adapt its manufacturing process from made to measure to mass production. Now that we had fixed the accuracy and the precision of the pipette, we realized that this accuracy and precision tremendously depended on the pipette tip design, its wall thickness, and the edge. The molding of the pipette tips in large quantities required very high quality molds and great regularity in the molding cycle in order to ensure absolute conformity of its dimension and shape. Understanding of the pipetting system function between the pipette and the tip became crucial. Whatever the precision of a pipette is, if the tip is not of quality, the specifications are lost. This was another challenge that we met with the expertise of our molding shop. During a meeting at the Pasteur Institute in Paris, I was asked to design micropipettes and corresponding tips to go down to the 10th of a microliter. We succeeded in designing the new models to cover the range from a 10th of a microliter to 10 milliliters. In another meeting, I was asked again to design sub-micropipettes to introduce viruses or even spermatozoids into living cells, but we found that only fine glass capillaries should be used for these applications. In this job, it was important that I remain in frequent contact with our end users. It did get a little hairy at times, or should I say, feathery. Once, I was asked to develop a pipette to inseminate partridges in an industrial farm. I was taken into a large breeding hall which was full of birds and feathers. I could not stand it, I had to leave. And I turned down the request. Today, the Pipetman is sold and widely accepted throughout the world. The success of this line of pipettes is well recognized. It also opened new markets for Gilson. The Pipetman became the flagship Gilson product in the US and Europe, starting in the early 70s. We pushed further afield, introducing this line of products and expertise in the Soviet Union as early as 1975, in China in 76, in Japan and South Korea in the early 80s, and many other distant countries where we were always greeted warmly. At a meeting and fair in Moscow, I remember walking down the aisles of the Soviet exhibition hall. I froze. There, on the stand, was exhibited an exact copy of our Pipetman. I was stunned. I took it in my hand, looked at it carefully, started to take it apart to see how it was made. The salesperson in front of me on the other side of the table looked at me and said, "Are you from Gilson?" "Yes," I said. He turned around and went to get his boss. We had a casual conversation. But since then, I have never seen any production of this counterfeit. After more than 20 years, the collaboration between Gilson France, located near Paris, and Gilson US in Wisconsin, developed further. In the US, the emphasis was put on the further development of HPLC, high voltage liquid chromatography, equipment with fraction collectors, detectors, and a big emphasis on easy-to-use software. While in France, development was centered on a line of manual and automatic liquid handling equipment with micropipettes and disposable tips, automatic sample preparation stations, high-pressure pumps, and auto-injectors. For the latter, we developed expertise in microprocessor-driven motors and software. In order to cover the difficult problem of handling viscous samples, we designed the Microman, an original, patented, positive displacement adjustable micropipette with disposable capillaries and pistons. It was another first, which eliminated any cross-contamination from sample to sample. This was the time when PCR, the polymerized chain reaction, was first developed in a research lab in California. It became more widely used. For this new technique, the exclusive use of the Gilson Microman was recommended for its total absence of cross-contamination between samples. The demand far exceeded our forecast, and it took us some time to increase our production capacity. For more than a year, we had a hard time to meet market demand. We completed the line of products with a patented adjustable repetitive dispenser and its disposable syringes. Our production facilities in France were moved several times to bigger premises until we had a new plant built in the same Paris suburb where we had been based since 1962. Meeting market demand for our products remained our most important challenge, and we spared no effort to increase our production capacity. We also had to adapt our production method and procedures to comply with new quality assurance standards. Every pipette was identified with its own serial number throughout the line of production and in the control room. The calibration results obtained with the newly available electronic microscales were recorded on each calibration station, equipped with a tabletop computer and archived in our central computer for traceability. Gilson in France became the expert center for the development and manufacturing of the Gilson manual liquid handling line of equipment. Being present and active in many countries, we had to organize service facilities with repair and recalibration expertise with our distributors. Some pipettes were coming back for repair after having been contaminated with radioactive markers. To prevent these contaminated pipettes to come in contact with our technicians, the rest of our equipment, and other pipettes being serviced, we had to ask customers who had shipped them to us to come back and pick them up, to decontaminate them first, before we would service them. In order to isolate these pipettes, we equipped our service facilities with Geiger particle counters. Gilson, as a global company, had become a well-recognized manufacturer of original instruments for the bioscience labs in university and industry. The Gilson saga is a good example of how a university professor succeeded in developing a small business in Wisconsin. With his forward-looking vision, his close association with his fellow scientists from the university, and its association with the foreign university students, his then small business became a recognized company with worldwide activities. The company currently has branches, exclusive distributors, and dealers in 91 countries. Today, under the presidency of Robert Gilson, the son of the founder, Dr. Warren Gilson, The two companies employ about 400 people around the world and have sales of well over $100 million. The two research and manufacturing units have been consolidated under the centralized management led by Atika El Sayed, who is now Chief Executive Officer. I remember hiring her as a product manager for our pipette products in 1986. The company head office is still based in Middleton, a few miles away from where we are today. Strategic development is coordinated to take advantage of the combined expertise of the French and the American teams. Numerous patents have been applied for with worldwide protection to cover the latest development. Last year was the 40th anniversary of the Gilson Pipetman, which is still manufactured and has remained to this day a recognized market leader. It is remarkable to see that the Pipetman Classic has become such a standard reference for scientists, and how so many of these original devices, some of which being 10, 20, 30 years old, are still being used daily. That shows the robustness of its design. And of course, Pipetman has become something of a star on television and appears often on scientific and medical TV programs. Beyond its simple design, robust construction, and ergonomic, we believe it is the quality assurance process which guarantees the specification of the Pipetman that explains the long-lasting market acceptance. But just because the classic Pipetman does so well, does not prevent the company to keep innovating in this line of products. New products have same general appearance and iconic design, but have been adapted to meet new market needs. The Pipetman Neo was introduced to address the concern about repetitive strain injuries. The Pipetman M is the lightest motorized pipette. The latest Pipetman L has been designed to meet the needs of GLP labs, good laboratory practice, to help track the pipette's performance and service. These constant innovations are driven to meet the ever-evolving market demands. Under the initiative of Dr. Warren Gilson, the University of Wisconsin-Madison Scientific Community in Biosciences participated in the starting up of a small business that expanded into a recognized global company, which in turn, through innovative solutions and wide collaboration with research labs, took an active part in the advancement of science. Thus, since its inception in 1945, the Gilson company never ceased to grow and expand. I couldn't bear to end this quick presentation without expressing my sincere thanks to Warren Gilson, whose vision and trust gave me, as well as other students from the university, the opportunity to express and develop our talents and involve ourselves in creating small businesses that ended up growing into global companies. Today, building up on its manual and automatic liquid handling expertise and pursuing its close collaboration with scientists in the same spirit of continuity, Gilson intends to remain at the forefront of bioscience research. Gilson is moving today into a new phase of its development with automatic sample preparation techniques and protocols used by numerous new biotech companies for developing new therapies. I'm now proud to turn over to Kevin Barrett, Vice President, Business Development Manager, who will introduce and present the latest innovation from Gilson, the Pipette Max. Thank you. Thank you, Kevin. Thank you.
Okay. What a great accent. A hard act to follow. Okay, I'd like to start, of course, by thanking Eric for that excellent insight into the origins of the Pipetman. I plan to just take a few more minutes of your time just to bring the story up to date. The Pipetman is indeed one of the most recognized brands in research today. Research, of course, is an evolving field. Milestone events like the mapping of the human genome a decade ago now, pharmaceutical companies talking about facing the patent cliff, outsourcing and partnering going on like speed dating today. These events grab the headlines, but the underlying trend is that the pace of research and discovery continues to increase. It's understandable when researchers see within their grasp discoveries that hold potential to predict, to advance treatment, or even prevent serious and chronic disease. It's this goal that fuels the seemingly exponential growth in the rate of research that we see today. But we realize that this pace of discovery is often hampered by practical challenges. At the time Eric described introducing the first generation Pipetman, the majority of liquid handling was performed in a range of vessels, but typically racks of large tubes were used. Now, especially in the life science disciplines, most of the work is done in microtubes and microplates, 96 well, 384, 1536 well formats, and even smaller chip-based technologies. These higher density formats, of course, allow the researcher to increase their throughput. At the same time, they reduce the cost per sample by reducing the volumes in the wells. All this is very positive. But any researcher that's actually spent hours and hours manually pipetting low volumes from one plate to another plate will often share just how much they enjoy the process and how their life is actually richer for the experience. I actually have taken some liberty here with the top right image. I'm not suggesting that researchers start that young, but I just thought the expression captured the sentiment. But there is a serious side to this. Basically, with the high-density plates, any errors that might happen due to distraction or boredom tend to be very expensive. Expensive in terms of dollars, it's expensive in terms of resource. For certain operations, there's no real alternative to the manual approach. In the development phase, you just need that level of flexibility. You have no other option. However, for more routine processes, there's a whole industry that's actually developed to make, for example, sample prep easier, more consistent, and more repeatable. Standard methodologies or kits exist to prepare samples for a wide range of analyses and a wide range of techniques. PCR, qPCR, preparing samples for pre-PCR work, isolating your DNA, post-PCR cleanup, liquid handling steps for cell-based assays, plate preparation, library preparation for next-generation sequences. The kits and methods that keep coming out seem to emerge daily. This market is growing. Additionally, there are many vendors now providing very sophisticated, automated liquid handling systems that can easily handle these routine processes. In fact, the majority of these workstations were developed for the high-throughput discovery labs, so they can handle hundreds, maybe even thousands of plates at a time. At Gilson, we believe in working closely with researchers to identify their needs and understand their challenges. And we use this to direct our product development. Our researchers told us that although these systems were in fact excellent at what they did, being designed for HTS, high-throughput screening, they were sometimes overkill, often larger than they needed, often more sophisticated than they needed for some of these routine tasks. So it was actually this feedback that drove the development of what we believe is the natural extension to the Pipetman range, the Pipette Max. The Pipette Max is a small, easy-to-use, affordable pipetting station. It handles 96 384 well plates or microtubes based on the standard SBS format. Inside, we have effectively 2 Gilson 8-channel pipettes. The platform also represents the combined innovation that's evolved across Gilson's 2 main facilities, as Eric mentioned. The XYZ platform expertise that's developed just down the road here in Middleton, together with the pipetting technology that was developed across the water in France. So a response to the evolving needs in the research market has actually resulted in producing the first instrument in our history truly combining these two strengths. Now, the story began here at UW some 50 years ago, and I'm pleased to report that that collaboration continues today. As an example, Professor Dave Beebe's group has already worked on some very early versions of the Pipette Max and will soon have access to a pre-production unit to work on a number of research projects, including the one on the screen, which is funded by the Bill and Melinda Gates Foundation. We consider these collaborations essential to ensure companies like Gilson continue to develop solutions meeting the needs of researchers. It was important 50 years ago, and it's equally important today. I would just like to wrap it up at this point and ask my colleagues to join me on stage to answer any questions. While we do that, I'm going to be challenged by technology. I'm going to try and run the video of the Pipette Max, so that'll be going on in the background. And we'll see if this works. Okay. Okay.
Good work.
It works. Okay, so thank you very much for your time, and we'll take any questions that you have right now.